So Naisha, it's my pleasure to introduce you, and thank you so much for making time for us. Naisha has a 20-year career at Pfizer and serves as Vice President, Product Access, Global Health and Social Impact. Her team is focused on eliminating the patient affordability challenge, creating last mile access solutions, and driving colleague and community engagement at Pfizer. In this role, she's accountable for Pfizer's US Patient Assistance Program, administered through Pfizer's RX pathways. Some of this stuff is very scientific and I can't always read it. So it's RX pathways. She also drives signature international product donation programs, including the International Trachoma Initiative. She also works on engagement with community-based organizations in selected developed markets and also co-leads Pfizer's Multicultural Health Equity Collective. This collective focuses on achieving health equity across ethnic groups and other underrepresented communities facing significant health disparities. Her professional experience prior to Pfizer includes roles at the National Football League, the NFL, at PwC. She also has a long history of volunteering, as if she doesn't have enough going on, including mentoring students and serving as chair of the board of managers at the West Side YMCA and a board member of New York Edge. Naisha, it is my extreme pleasure to welcome you. Thank you so much, as I said, for joining us. Let me start with a basic question. So the term health equity is used widely, but it means a lot of things to many different people. And there's also a lack of common understanding of what it means. How do you and your team define health equity?
Well, good day, patients, and thank you so much for having me here today. I feel like this is a long time coming. We've been talking about it for so long, and I'm more than pleased to be here with you today and the rest of your audience. So for me, an articulation of health equity is best in a story. So I have been with Pfizer for nearly 20 years now. And one of my many roles, I was what we call the corporate affairs lead for the rare disease business. And as the corporate affairs lead, I worked with many different colleagues in communications, public affairs, policy, and other roles to really figure out how we can promote an access-friendly environment for products that patients needed so desperately, especially in rare disease. And so I was at a conference in Washington, D.C. that was hosted by the National Newspaper Publishers Association. And NNPA is a collection of editors and journalists that focus on mostly Black American newspapers. Mm-hmm. And we invited a mom and her son. Her son had sickle cell disease, which, if you don't know, it's a crippling disease of immense pain. And they stood up in the audience and they told the story about how he had been in the hospital for several days. And when they arrived at the hospital, because he'd gone so often, because he has these pain crises often, he was made to wait in the emergency room because they thought this 12-year-old was a drug seeker, and not that he had an awareness of what he needed as a therapy and treatment to get his pain crises under control. Mm-hmm. And so when people show up to the healthcare system and they are not given equal treatment, for me, that is not health equity. When you have diseases such as trachoma that only exist in developing areas where they don't have access to clean water, that is not health equity. And so for me, health equity is when everyone has the same opportunity to achieve their best health outcome, whether it's access to health insurance, utilization of quality health plans, being able to visit their physician, not being in a doctor desert, so to speak. And if they get the treatments equally based on their symptoms and not their ability to pay, or what someone's preconceived notion of what their pain tolerability might be. That's what it means for me to have health equity. Everyone is able to get the access to the treatments and the quality of care that they need and deserve.
Wow. Thank you for that. And I think this, the story that you tell, at least for me, and I hope it does the same for those of us in the room, grounds this conversation in how serious this conversation is. And so thank you for sharing that definition, that storytelling and definition of what a health equity means. So can you maybe tell us a little bit more about the actions that your team is taking and how Pfizer is supporting this idea and potential reality of health equity?
Yeah, so Pfizer's mission is breakthroughs that change patients' lives. And it's not simply about the brilliant scientists that we have working in the labs across the globe. It's really about our ability to make sure that our medicine is accessible to all. You mentioned the International Trachoma Initiative, and I talked a little bit about trachoma, and let me define it in my layman's terms. My background is accounting, but I came to global health, and so glad that I have been able to. But trachoma is an eye disease that causes blindness, and it's totally preventable. Right now, it impacts about 1.9 million people in the world. About 20 years ago, Pfizer, along with dozens of other partners, up to 90 at some time during this 20 years, committed to trachoma elimination, committed to making sure that just because you were born in a place without access to clean water, you did not get this eye infection that essentially causes the eyelashes to curl in and scratch the cornea, which causes the blindness. So we committed with all of these organizations that we're here to eliminate this disease, and we're going to do everything that we can. So the WHO created a strategy, which is called the SAFE strategy. And our part of that, SAFE stands for surgical intervention, antibiotics, facial cleanliness, and environmental safety. And so our part of that is the A, the antibiotic. And Pfizer has been donating Zithromax to help treat and prevent this disease, this infection. And so if you think about all the partners that have to come together, us with the donation, funding organizations across the globe, including USAID and others. If you think about local healthcare workers who may not get paid, but they are their local villages' best help to make sure that product is getting into the communities and people are getting treated. All of these people have to work together to say, we are here to do this work to eliminate trachoma. And Pfizer has been supporting this program, like I said, for 20 years. And that's through CEO after CEO. So that demonstrates our commitment to eliminating this disease. Another area beyond product that Pfizer is involved in is what we call our Multicultural Health Equity Collective, which I have the good fortune to co-lead with my colleague, Melissa Bishop Murphy. And it was her brilliant idea even before I came to the party, so I have to give her accolades there. And what it is in the US, we partner with national organizations that have chapters across the country that have been focusing on health equity before it became in vogue, right, patients? Now everyone wants to do it, everyone's the expert, but there have been grassroots organizations that have been saying there are systemic issues that are preventing our communities from having equal access to their best and healthiest self. And so we partner with these organizations in many different ways, organizations such as the National Medical Association, or the National Hispanic Caucus of State Legislators and others. And so we partner with them to say, what is it that the community might need from Pfizer? Do you need our medical affairs teams to come give briefings on different disease areas? Do we need to partner together on advocating for issues that are causing barriers for people to really utilize their health insurance, like copay accumulators, for instance? Do you need us to work together on health literacy materials so that they are culturally appropriate in languages that people understand. We know that English is the primary language here in the US, but so many more languages are spoken. And so, how can we be a partner to all these organizations who are on the ground doing the work to give them what they need to advance health equity? And so, those are a couple of examples I'll share with you today. Another example on a product front is in the US, we have a US patient assistance program where we're committed to ensuring that those who cannot afford our medicines have access to them. So those are some of the ways. From a product standpoint, I gave you two examples, and then in partnering with the communities, understanding that there are others who are experts in these areas, but we have tools and talents and treasures that we can bring to bear in different ways to help support the work that they're doing on the ground.
Amazing. It's incredible to me that a simple, it seems like a simple thing that if one is born with sight, with the advancement that we have across, science and everything, that for people to lose sight because of poor access to water, that then leads to blindness is incredible to me. And the number that you mentioned, 1.9 million people around the world impacted by this.
Yeah. And
And
just
also,
one more point, patient, I don't mean to interrupt, but and that's the number today, right? It was much higher years ago. And just recently, the WHO identified the 15th country in which we've been able to say that trachoma has been eliminated. So these are real lives. These are people who don't have to be in generational poverty due to blindness because they can't work the farm or they can't do, those things to provide for their families. So I wanted to highlight that as well. And Malawi is the latest country where trachoma elimination has been declared.
well done. And I was born in Zimbabwe, so Malawi is like two countries above from where I was born. And the reality of what you just said is drives home very clearly for me. But a number of things that you said demonstrate the knock-on effect of one thing leading to another. To your point, lack of access to clean water, drinking water, leads to disease, and then if we don't take care of people, if there aren't systems to take care of people, it leads to perpetuating poverty, to the point that you made, that they can't farm for themselves, they can't provide for themselves because now they're dealing with blindness. But also, what I'm picking up from what you said is the complexity of the system of delivery. So there's the product, and then there's the channels of delivery, and how working with those who are proximate to some of these challenges is really critical as well. Can you maybe elaborate a little bit on some of the elements of these partnerships? What are the three best practices that you and your team have pulled out and said, when we have these three things in place, we can bring together experts and stakeholders and the machinery of delivery, whatever it is, to get to a place of elimination. Let's continue with trachoma. I mean, you said that Malawi is the 15th country, so some things must have been done right. What are those elements of those partnerships?
Well, people say you make friends before you need them, right? And so, really making sure, and I tell people this all the time, this is recorded, and I think I'm going to say it anyway. Um, I want to talk to people outside of Pfizer just as much or more than I'm talking to people inside of Pfizer. I don't want the group think that can develop when you're talking to the same people over and over again. And so, if we are to expand partnerships and combat these massive challenges that are ongoing, we have to continue to talk to people, articulate what we're working on, share information so that when a challenge does arise, you know where you can go. And I think that's what happened with trachoma. There are people and organizations that have been partnering for a long time saying, oh, these are the challenges that we're seeing. We'd love to work on something like this together. And so, really figuring out who has the shared interest and goals, being transparent and what that ultimate end goal is, because that's the only way to develop trust, and then reporting out on your progress. So I would say those are the key elements, making sure that you identify the partners, what's expected, not be nervous about or ashamed to say, hey, this is not working. How can we fix this? Building that transparency and trust in the relationship. I would say that, there have been some challenges definitely along the way, but we know to whom to go and talk about, okay, we need additional funding here. We need a new partner here. And we have these massive meetings several times a year with our partners at the International Trachoma Initiative, where the local workers come in and they say, this is going well with surgery. This is what we need help in. And we figure out how to, to support those local workers. We talk to them about our production schedule with Zithromax and where that is, so that they know when they can expect our medicines. When we have issues to transport the medicine, it can't go, by its regular container. We are working with transportation and logistics experts to fly planes loads of product where they need to go. So this type of transparency in the partnership, I think really has what's gotten us to that 15th country, as you said, patients, and really making sure that people know this work, know where to go to find information, and know how they can contribute as well.
Wow. Just to bring it home a little bit, Naisha, is there an equivalent example? Because, we have people in the room who might be ex-US folks, but for the most part, we have people here in the US. And I think when people get to understand the level of health inequity in their own backyards, maybe, it translates a little bit more. Can you maybe give us an example of something similar, a similar program that you're working on here in the US?
So one of the things that we did, and I can talk about the work that we have done with our Multicultural Health Equity Collective. And so there's an organization that's part of that group called the Hispanic Federation, and they've been a longtime partners of us, and they're simply amazing. We partnered with them last year to conduct a radio program. We called it a radio virtual health fair, and it was all in Spanish language. Why is it in Spanish language? And why is it radio? It's Spanish language because we know that here in the US, we have a lot of immigrants, and they come and they learn the language for sure, but the language in which they may be most comfortable may be Spanish. And we know from our research that many of our Spanish speaking residents get their information from trusted voices. And some of those trusted voices are radio voices. So we partnered with the Hispanic Federation, our own internal colleague resource group, and put on a program that was on the radio. We focused on cancer screenings because we knew that throughout the pandemic, people had stopped going to the doctor because things were closed down, and they weren't getting the proper screening. We talked about COVID, of course, because you can't have a conversation these days without talking about COVID. We talked about our patient assistance program. So all of these things in the language in which people usually receive their information, are most comfortable receiving their information from the sources that they wanted to hear from. And we partnered with organization, and we did a three city radio pilot. And what we saw was that there was a 60% increase in visits to a particular website that we had a call to action as a result of that program. So we partnered with organizations that were trusted, language that was culturally relevant and appropriate. And we weren't saying, oh, hey, we're Pfizer, we're doing this. No, we put everyone else in the forefront who would be trusted and who could provide the information. And that's some of the elements as well of health equity. And that's an example here in the US that we've worked on recently in the collective.
Great. And I'm guessing that in all of these programs, you are, working hard to do all the things that you talked about, establishing trust, having shared goals, monitoring the success, reporting out, and acknowledging the things where you're doing well and not doing well. And for an organization like Pfizer, a household name, for you at that level to be able to say there's some things we don't know and things we don't do well, and we may try to do things and we sometimes we fail, and we can acknowledge that, I think is part of that trust building. And I'm pleased to see that it's one of the elements that you think are critical to partnerships. Because Women of the World Endowment, it's in our name, is about, you know, how we centralize women as change makers and actors. I think in most industries, in financial markets specifically, but across most industries, women are seen as beneficiaries and victims. But in healthcare specifically, that makes limited sense to me, because we know that 70% of those on the front lines of healthcare are female. But we also know that less than 25% of leadership in healthcare is female. Can you maybe just share with us a little bit how you're seeing women showing up in the work, in all this work that you're doing, and also driving equity, because we know that women do more than just care about, you know, getting paid. They also care about the impact on the community. Could you share a little bit about that?
Absolutely. And I'll just share a little story. We're actually the Multicultural Health Equity Collective. We are planning a summit next month to really look at some systemic barriers to helping people achieve their optimal health. And some of the panels we've been putting together, I'm like, oh, we have 4 women on this panel. And I said, I've never had to say this before, but we need a man in the panel, right? Because to your point, we are showing up in healthcare, and not only in leadership positions and not only, you know, frontline caregivers, but if you think about moms in the household, like we are the chief health officer as well. And so I see women showing up in my very own company, some amazing leaders who are at the forefront of research and development, who are at the forefront of really raising their voices internally to say, are we paying women appropriately here in our company? Our chief health resource officer, people experience officer, excuse me, is a woman, and she's very much focused on making sure there's equitable treatment within Pfizer as well as outside. And so, you know, from a colleague development standpoint, certainly kudos to the organization to making sure that women are seen, heard, and cared for. But externally, when we go and make new alliances with some of these organizations, community-based organizations, by far, the leaders are women. By far, the executive director who's getting it done is a leader, is a woman as well. And so the ideas that are being generated, the ability to coordinate across the healthcare sector, I see a lot of women in those roles. And of course, we have men and as well. So not to leave them out, but as you say, women are certainly showing up, driving strategy, figuring out how to get things done and make them simpler, and really spreading the word about the work that's happening in healthcare and also what still needs to get done.
100%. So I just want to make the men in the room comfortable. We're not talking about removing and replacing you. What we're talking about is making sure that proximity to challenges that builds lived experience is important to have in rooms, whether it's, you know, innovation rooms. And I'm glad to hear, Naisha, you say that your R&D labs include women, the C-suite includes women. I think this is how we end up with a better world, with a world that we all want to see, right? So thank you for that. So as I indicated in the introduction to this conversation, Aisha, one of the things that drove the development of the Changemaker series is this idea that we can bring leaders and stakeholders into conversation to share solutions, to discuss challenges. But the other thing that we really wanted to hone in on is, how do we invoke moonshot thinking? And by simply asking, what if, you know, things were this way? So I have a question for you. What is your moonshot idea? And how would you finish this sentence? What if? And more maybe more interesting is, what do you believe it would take to bring that what if to reality?
Mm. So when we talked about this, I had one idea. I don't know if I think I'm gonna go in a different direction.
Go for it. And then also share your other ideas. Maybe you have
Really?
two moonshot ideas, and that's okay
I,
too.
I just, wonder what if we truly saw healthcare as the patient at the center. And we say it, but what if we only saw that patient as our son, daughter, niece, or nephew? How then might we deliver care? How then might we figure out health insurance that's not necessarily the best health insurance is not necessarily tied to where you work? How might we ensure that there is clean water not coming out of faucets and not brown water like we're seeing in Jackson or what we saw in Flint? How might we do all of the things differently if we were agnostic to where people lived, worked, played, and just always saw it as someone who was near and dear to us?
Hmm.
That was off the cuff. My other thing was like, how might we measure progress toward health equity in the same way? There are so many different players, as we talked about in this conversation, from for-profit entities, not-for-profit entities, and everyone's talking about it, but no one can really say we've made X amount of progress toward health equity. And
Mhm.
I feel that that is something that we might need to better land to ensure that we get more investments into the space. No one wants to invest in something that's just forever, just shelling out money. And we get that. We want to say we've done something, we want to feel good about that investment. And if we cannot clearly articulate the value and the progress, we will always be stuck in this idea of scarcity that cannot allow us to invest in health as we need.
Yeah. So I enjoyed the first one, and I took down my notes here, and I said, spoken like a true mother and a true human. And it's surprising that as humans we don't think that way. We don't see the potential of access to the most basic of things, and potential to access to opportunity as something that is possibly possible for
Yes.
everyone, not from the perspective of charity, but from the perspective of investing in our collective future, right?
Yes.
But then in your second one, which is the one that you had, to your points, prepared, you talked
Yes.
about this issue of measuring and evaluating progress and success, and then reporting that out and sharing that out. So maybe I can ask you, how are you collecting data? And maybe this could be one of those conversations we might want to open up to others, if that's how you'd like to take this.
Yes, every conversation I have, because I'm desperately trying to solve this, I ask people their thoughts on measurement and evaluation, and I would absolutely love to open it up. Because measuring and evaluation, especially in the context of healthcare, is challenging for sure. And at Pfizer, we've made several commitments to address health equity and how we measure it. We issue each year what we call our ESG report. Um, and in there, we try to measure like what we're doing in these areas. And a lot of it is based on number of patients helped. Um, and in my mind, yes, we've helped so many patients, but have we sent them back to the environments that made them unwell? And then, so we've done our part, but have we solved the problem totally? And we cannot by ourselves, by no means. But I think about that, right? We measure it in the patient's health, but is that the best way to measure it? Is there some other way that's better so that we can really figure out we are here health equity, and we're not going to have disparities in Black maternal health or other areas. So it's really complex measurement and evaluation. I don't have the answer. Certainly, we do track, like I said, usually in a number of patients helped. But there could be other ways. And, there are a lot of different data companies that are out there and thinking about these issues. And I would love to hear more about what others may have to say specifically about how we measure success in achieving health equity.
So with that, I think we're at that place where we might want to, with that invitation that you just issued to everyone, we can talk about measurement. We can talk about some of the other ideas that we discussed. But I would like to invite everyone else into this conversation.